like to call this Board of Health public hearing and monthly meeting to order. It's Monday, June 16th at 5 p.m. This is rescheduled from Wednesday, June 11th, 2025. And Ruth's not here, but I believe I have to open the public hearing, call it to order, and then close. Okay. So I call this public hearing for the Board of Health to order first and foremost. Would you call the roll, please?
Danielle Chenoweth.
Present.
Jennifer Locke.
Present.
Kyle Patterson.
Here.
The only thing on the agenda for the public hearing is the budget and appropriation ordinance for 2026, ordinance number 2025-0601. I would entertain, I believe we put this on file for 30 days.
It already was.
No, it was, actually, it was.
Was it
Yeah,
already
it
put
was.
on file? Yeah.
Yeah,
this
we
is
did it,
the-
I'm remembering, that's why we said, that's why we had to move it.
Yeah, yeah.
So this budget has been on file for over 30 days. And so I'd entertain a motion to pass it at this point.
So moved.
Second.
We have a motion and a second. Is there any discussion?
I have something I would like to say, that based on this budget, leadership, we've been talking, and based on this budget, what we would like to be able to tell staff, because, you know, we're in a crazy financial time, is to let them know that barring anything major, we will backfill, sort of, if we need to, with some fund balance money, and we'll keep things going for the next fiscal year. So we want to be able to tell people that barring anything major, like, who knows what major would be, but
Cutting all of like heap out at RPC, I guess it would be cutting wick out in.
yeah, like cutting
Okay.
a wick or something, which isn't gonna happen, we already got that one. But yes, like something major where, like a whole chunk, but we would like to be able to tell staff that we do not plan on doing anything with staff, like laying off or anything through the next fiscal year, so.
Yeah, I think it's prudent to say that that's
Because
our
it,
intention.
yes, because people with all the stuff going on in the news, it's gotta be scary. And I wanted to be able after this meeting, leadership will send out a message to staff letting them know that, you know, so that they can hopefully feel comfortable staying here for a year. Because if you think that, and we don't know, that's the thing. I mean, if we communicate when we know something, but we don't know anything. Even the things that are getting cut seem to be getting restored by the courts, which is a good thing, but we just don't know. So, we want to keep people here. It will mean probably, you know, shuffling some things around and having, because the 2 grants that we lost, we would like to be able to attach them to possibly some other grants and things like that. So that's the plan.
I think it's prudent to set the intention that we float the money because of it's majorly random at the federal level, and there will be elections in the not so distant future, and there's been a lot of pushback.
Yeah.
I did want to ask what grants had been cut and what the amounts were at this point.
So, Brandon's not here, of course, and that was his, do you remember how much those were? One was Whitney's, no, they were not Brandon's, they were Whitney's, they were both Whitney's. One is Will Women, which was not a large one. Oh, it was 100? Together they were 100.
Yeah.
I think both of them were 100.
I think it was 188,000
Total?
total.
Okay.
So what we'll try to do is get them into other grants doing other things that's similar. They're health educators. Both of them are health educators, so we're also looking for other health education related grants. And we are going to communicate to staff that we have done that we're in a good position going into this nightmare. We have the building paid off. We have solar on the roof, and I think that Brandon said one of the bills went from, one of the monthly bills went from 12,000 to 3,000 at peak. And we have, you know, obviously we have a healthy fund balance so that we, you know, we're in a position to weather a storm. That's what we do, whether it's a pandemic or the state budget or the federal nonsense or whatever, we have to always be ready. I've already given the county board a heads up that, you know, what grants have been cut. And Whitney actually wrote 2 of the people into the grant we hope to get from the County Board of Health.
Okay.
So, and we're looking at a variety of things, like with dental, doing more, ramping up production. We're looking at, what are some of the other things? We're gonna have to look at the fees for environmental health, because we haven't done that forever. That's not a popular thing, but it's nowhere near, what it needs to be, and that would be for the county as well, so that's kind of where we are. That's the state of the district.
Okay.
Any questions from the board members? Comments?
All right, well, we appreciate you as we weathered the storm. That's my comment. All those in favor say aye.
Aye.
Actually, I'm sorry, this needs to be a roll call because it's budget, sorry.
Daniel
Roll call,
Chenoweth,
please. Yes.
Jennifer Locke,
Yes.
Kyle Patterson.
Yes.
Great. This public hearing is now closed, and I will call to order the meeting agenda. Could we please call the roll again?
Daniel Chenoweth,
Yes?
Jennifer Locke,
Present.
Kyle Patterson.
Here.
Great. I would entertain a motion to approve the agenda.
So moved.
Second.
I have a motion, a second, any discussion? All those in favor say aye and do the wave.
Aye.
Aye. All those opposed. Next, we have approval of minutes of the previous meeting. I would entertain a motion to take them in omnibus fashion. First is for April 16th, 2025, special meeting, and the second is for May 14th, 2025, special, regular monthly meeting.
So moved.
Second.
No motion, a second, any discussion or changes? All those in favor say aye or do the wave.
Aye.
Passes. We have public participation. Maybe. Thank you.
See, you're public. Yeah, Dave, you're the only public. Would you like to?
It's easy.
address the board?
We're kidding, we're kidding.
It's nice to see you. Next, correspondence from our public administrator.
I would like to introduce Mamadou Tonkara, who is our new deputy administrator. He comes to us from Utah, and he got out just in time to save his teeth because they just outlawed
Oh, yeah.
fluoride, like Florida. And so he is.
Welcome to the land of the free and the home of the brave.
He's already noticed me in the land of the corn. He's fascinated by our corn. And I just had to explain to him today that that's not the corn on the cob. He was like, "What did they do with all that corn?" I'm like, "That's
Frito-Lay.
Frito-Lay.
Go by the Frito-Lay factory. You'll
Exactly.
see.
But he is, so I'm an MSW MPH. He's an MSW MPH MD. So, and he's got his MD in Malawi. So he is not practicing in the U.S., but you can't suck that information out of their heads.
Yeah.
So, and he also speaks French and probably a lot of other language he hasn't told us about yet. But French is the one that we will be in need of a
Yeah.
lot, so it is wonderful. So he has been here, how long have you been here now, 2 weeks?
Yes.
Today's the start of your third
Met
week.
you on your first day.
Yep, yep.
Welcome very much. Are you aware that the city of Urbana's sister city is in Malawi?
Malawi. I'm actually from Mali.
Oh, Malawi.
I said this last
sorry.
time, I was said Mali and you
I'm
said
so sorry.
Malawi, I thought you said Malawi. And I
Very
was
sorry
like,
then.
Mali, I'm sorry.
No, we did not have a sister city in Mali, but we did in Malawi.
Wow. Okay, I didn't
Lord.
know
Oh,
that.
yes. Welcome.
Okay, sorry about that.
It's okay.
Mhm.
Very
I'm sure I'll flip it every single time I introduce you, it'll be different. I'll try to hit all the African countries.
There's an app for that, you know.
Yeah.
You
there
can
is.
study.
I know there is.
You should. Good.
Okay.
We appreciate you. Thank you. Welcome aboard.
Thank you.
Any other correspondence?
Yep, that's it.
Okay. I just want to share correspondence that as of today, there is no, there's the seeds of an effort to make sure that there's appropriate cooling spaces in the community, well, to basically make a map and a calendar and a schedule. But as we learned in the winter, during the winter months, there were significant holes where it was freezing cold and there was literally no open place for them to go, for folks to go who were unhoused. And so there were big holes. One was Sunday morning, and we attempted, at least with the PB's program, to fill that gap just for the 21 who were staying with us, but for the many who weren't, It was a gap. It came to my attention that MTD only allows folks, even if they have a bus pass, to remain in the terminal for 1 hour. It's not a behavior-based approach. I would like to encourage public health to reach out to MTD and speak to them about this issue, because I feel like it's a public building. It was listed as a warming center, and I have evidence of a gentleman who had a bus pass, who is not a behavior issue, who is in so much pain he couldn't get on the bus. It was 16 below wind chill factor, and he was ejected from the MTD terminal on a Sunday morning during the winter. I have brought to their attention that I believe this is against the Homeless Bill of Rights at the state level. They say it's not. They're not the only one. I don't mean to pick on MTD, because they're actually a very awesome service in our community, and they do a lot of work, and they really try, but I'm giving it as an example. I recently reached out to Brookings, to the county executive, to ask if we could have a cooling space in Brookings because it's being vacated. Originally, I got the tentative yes, then more recently I got the no, because the state's attorney's office is concerned about homeless residents being in the building. And I just really have to ask the question, like, you know, what is a public building worth if it's not to save people's lives? I really think that the community needs to take a behavior-based approach. So whether I am unhoused or not, if I'm freaking out and taking all my clothes off in public health, then you need to call some help in, right? It doesn't matter what my status is as a house person or unhoused.
That's what we have.
So public health has been amazeballs, that's a technical term, in this arena, in that, like, we can send people to public health when there's open hours and you've taken a behavior-based approach. And I feel like the next step that I'd like us to take is that public health be that model and that advocate and that convener to talk about how to address the need for cooling centers. According to the best in weather, which, you know, for what it's worth, there's supposed to be a tornado on Wednesday. We have the biggest tornado season we've ever, had in decades. It's supposed to be significantly hot. And if it's hot and there isn't a place for people to cool down during the day, it could become deadly. And that place needs to be on the bus line. So I know public health is going to be a place during the hours that we're open. We're not open on the weekends, and so the question is, where else can people go? And really, it's an answer. I feel like because I, as Cunningham Township Supervisor, has taken the lead on some of these crisis moments, people then assume I will do it every time, but I just want to state to public health that me and my team are stretched beyond capacity right now. We are relocating like dozens of residents from condemned buildings. Thanks to the city of Champaign Township, we were able to get some rental assistance to support the residents at Champaign Park Apartments who have income. We are on track.
Are you finding apartments for them? Are you
Yes.
finding housing now?
Yeah, I didn't break thumbs for it, but,
Okay.
it was, but yeah. So we have 12 households that will be housed imminently, at Champaign Park Apartments. Things are going well there, but that's 12 out of we're working with 28 households total. And then there's dozens more. Our street outreach workers say that they think there's over 100 people living in that abandoned building. And we know there's about 20 in the viaduct, 20 unhoused residents in the viaduct. And then I know, at least last time I asked City of Champaign Township, the wait list has been ranging between 30 and 50 students. So essentially, we have half the number of emergency beds that we had 10 years ago in this community. And so everyone acts like it's a surprise that, why is it we're full? Well, you just look at the data. I do think that the continuum could do and I am the vice chair, but that doesn't mean I have the capacity to do everything. That the continuum has really good data, and I feel like public health, especially as we go to public health 2.0, as I understand.
3.0.
Excuse me, 4.0?
3.0.
Public health 3.0 that our goal is to really help to bring some that data forward, put together stories of what that looks like and try to find solutions. So it's
Yeah.
not, I do know we're coming off a pandemic and this team, like the whole team in this building worked their tushies off. And we've had a little bit of a, reset time, but I really would like to see public health lean in on the issues of not only housing and homelessness, which is actually just a piece of it, but really climate catastrophe and all of the things that come with that, right? So I was at Steer Place on Christmas Day 2 years ago, literally it was Christmas Day, and their boiler was failing. And the question was, what happens if the heat goes down? Where are they gonna go?
There is a plan for that.
But is it a plan that actually has all of the ducks in a row? Like, is it ready to be executed, or is it a plan on paper?
Well, let's put it this way.
Mhm.
It's not our plan, it's through John Dwyer, and in the past, when we've had to open these, this is the confusing part about it. What they do, the emergency management thing, and what they can do, is only for those type of things. So yes, if somebody loses air conditioning, if somebody loses heat, if the power goes down, if, anything like that, a shelter can be opened up in the community with the Red Cross. So we have some of the cots, there are the supplies to set it up. We've done it after Gifford at the tornado. John did that, and we are part of it. Where we have the special needs sheltering piece. So what we do, we take a little bit different approach, but we go in there and we case manage everybody that's in there.
Okay.
Find out.
Public health does.
Correct.
Okay.
Like what do you need? For example, with the tornado, people's WIC coupons have blown away. They didn't have any money. They need baby formula. They might need breast pumps. They might need HIV medications.
Yeah.
They might, so we have done this model a couple of times. So it exists. The question that I can never seem to get a good answer from anyone is, where is the Red Cross, and what if the disaster, because they don't have hardly any volunteers anymore.
Yeah, I've had to do their work for them, so I
Yeah,
have
so
a lot
I
of
mean,
confidence.
so we do need to, check.
Test
do
the
you-
emergency system.
Correct. Do you have any idea, Rob, where that is right now? I know Lauren would be the one to ask, but.
No, we had an exercise, it was like 2 months ago. And at the time, John didn't have a contact for Red Cross, so.
Okay, that's a huge problem.
The first.
Nor is the
first
city
step.
of Urbana for that matter, because, we've been told people will be contacted with the Red Cross, and then the participants we work with, we're not, when there's a building condemnation or a fire, then they're not. It's uneven. So there is that piece. The other piece is I was told that Brookings was the place that they would go, and, and it is, but it's unclear exactly what that looks like. And then I'd like to know when the heat is so hot or it's so cold that people are exposed to the elements, what is the mechanism by which to mobilize that emergency response?
Or where did they go when there's a horrible tornado plan to come through? Because now we actually do have some time for that, which we didn't used to.
Yeah, and so if we think that our tornado is coming on Wednesday, for example, which is what the current, the tornado-like conditions, is there a way to tell folks on the wait list of strides, people staying at Champaign Park Apartments? We now have, at least those who have phones, we have we have text message phones for them. Where do we, how do we basically communicate to people where they go? Because it really is a moral injury to have street outreach workers where we can say, there's a flash flood coming, but there's actually no place that you are allowed to go. You will be thrown out of you'll be thrown out of OSF, you'll be thrown out of Carl, you'll be thrown out of MTD after an hour.
Yeah.
It
It was like my question.
Stratz has 35 spaces in the day room.
It was like the last meeting where I asked, if you don't want the homeless under the viaduct, where would you like them? Because they are people that have to go somewhere. They don't magically disappear. They need to be somewhere 24 hours a day.
Yeah.
Whether that's, at a job part of the time and then into another place.
Yep.
You can't, so.
And that's a public health issue, and so I'd like to ask for additional leadership in that. And I know you all have been, we've been at the table, and public health has been the lead in
Well-
winter, but now that we have a deputy, and, you know, and we're pivoting, I just wanted to bring up that issue that,
Yeah.
you know.
And
it's a-
there is a precedent for that too, with the Cherry Orchard situation, to call a meeting and say, this is an imminent issue, let's get something figured out.
Mhm.
And we need to have, you know, the cities at the table, the county at the table, it's a different group, because it's bigger than just the homeless
Yeah.
situation, we have to deal with that, like people
Yes.
who don't have a place to go when it's horrible out.
Yeah, I actually think that's a better frame for the political circumstances
Yeah,
we're in
because
this
it's-
community, is if it isn't only the homeless, it is people who don't have a place to go.
But even with it, you know, people don't have to be homeless, but they have to have housing to not be homeless. So
Yeah.
it's the same people that, you know, we're dealing with all the time, that, I don't know, it is irritating when I keep like banging my head, it seems like against the same thing over and over, but, yeah, we have to get to the place where everybody understands that they have a piece of this,
Yeah.
and that, so, you
I'd
know.
like to see us propose an GA that basically looks at, that, you know, to establish a protocol with greater and greater climate instances, and also an increase in the unhoused population, where we basically have in writing a coordination of how we mobilize. Because right now, we're doing that within the continuum of service providers to the homeless, but that entity doesn't actually have the resources or authority. So we can dream all we want
Yeah.
about what we want to do, but it really is gonna take.
No, it's gonna take a different kind of meeting.
Yes.
And we have to say that we need, whatever it is, to get people in, we need more housing, we need more affordable housing, and that is something we can't do. We're not gonna
Yeah.
build them, we're not gonna change the policies, they need to do that. And, we need to have places for people to go, and the emergency house, or the emergency shelter should be literally that, an emergency shelter, you know, where so you move them up through the programs. I'm
Yeah.
preaching to the choir here, but you know what I'm saying, that should be a very tiny number for true emergencies, and there should always be bandwidth there. So if there's something happened, they should always be able to go there. Not like a tornado or something. The
Yeah.
Red Cross can get off their butts and do what they get, bring in millions and millions of dollars for. But other things, they have to do that in order that we have, just like they were talking about with the situation of not being able to move people out, that are ready to go into transitional housing because they can't get the inspections done.
Yeah.
So, I mean, there's gotta be a way to help clear that,
Mhm.
so.
That is the continuum's job, but the other piece, which is where people go in an emergency when it's about.
Yeah, well, that one I can
That
get,
is the
I
piece I
can,
think we should hold.
that one I can do we can do a meeting with that.
Okay.
And that will, I don't know how that ties in with the climate change stuff you're doing, Rob, is that ever talked about? Because that is one of the issues, is people are exposed down in the, the stronger storms,
Yeah, they're trying to work on like a prediction model to see, to have inputs on like temperature that might predict how many people they'd expect to see in the emergency department. So it's more so for healthcare.
Mhm. Okay, well, it's,
okay. I wasn't sure what it was.
Mhm.
What it was doing on that one, so.
if there's no further correspondence, I don't see any old business, we'll move on to new business. I don't think Ron's here today for treasurer's report, right? We do have the written report and the documentation, and so I would entertain a motion to accept the written report by our treasurer.
Second.
A motion is second, any discussion? All those in favor say aye.
Aye.
Aye, opposed, that carries. Next, we have approval of payments of Board of Health appointees to Treasurer Ron Fields for May 2025 services, to Attorney Lyman for legal services from April 16th to May 15th, 2025, for the Administrator Julie Pride for mileage reimbursement for the administrators meeting and moving to normal. I'd entertain an omnibus motion for those.
So moved.
Second.
We have a motion, a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have a review of monthly credit card statements. Any questions about the statements? If not, I'd entertain a motion, to put them on file.
So moved.
Second.
We have a motion, and a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of check request payable to Dental Imaging Technologies Corp. For Nomad and Dexis sensor. Oh, excuse me, sorry. Approval of check request payable to Davis Electric for new power and data to new walls and lighting.
So moved.
Second.
We have a motion, second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have ratification of check request payable to Dental Imaging Technologies Corp. For Nomad and Dexis Center.
So moved.
Sensor.
Second.
A motion, second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval for check request payable to the Champaign County GIS Consortium for July 1 through June of next year, 2026, membership and digital data license agreement.
So moved.
Second.
There was a motion, a second, any discussion? All those in favor say aye.
Aye.
Aye, opposed, that carries. Next, we have approval of revised lease agreement with Promise Healthcare.
So moved.
Second.
We have a motion, a second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of quote from Kronos Share Inc. UKG for Human Resources Information System.
So moved.
Second.
A motion and a second, is there any discussion? I had a quick question, which is this a new piece of software?
It is, it's a third-party administrator to our current payroll system in HR, and the one that we're using currently is not adequate for what our needs are.
Okay. What's the total, I was trying to look, what the cost is on it.
I don't have that information in front of me.
It's, okay, wait, hold on, here it is. It's,
like 9,000 or something.
$9,000? So,
The
805.50 a month, right?
yeah, you go $550 a month, and then it looks like,
yeah, there's some
Equipment
one-time
fee
setup charge, and
fixed
then
fees.
there's the monthly charge, so.
I think in the packet that we have, it listed out the 805.50, and then the next line gave us like
Got it.
the annual of it, but
Yeah,
it's
yeah.
the same number, right?
Yeah.
okay, and this replaced, okay.
Yeah, it replaces one that we have currently that's, it's been trouble for us for a long time.
Okay.
Since we implemented it, so.
Okay. Thank you. Any other questions? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of an MOU between CUPHD and Douglas County Health Department for fiscal year 26 Illinois tobacco-free community grant activities.
So moved.
Second.
We have a motion and a second. Is there any discussion? All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have approval of bids and awardees for multiple CUPHD facility projects. I'm gonna read them all off and take them.
Wait a second, you missed 11.
Oh, sorry.
Oh, yeah.
No, I'm going
Bid
too
for
fast.
Imperial
First, we'll have approval of a bid from Imperial Surveillance for security cameras.
So moved.
Second.
We have a motion and a second. Is it, we're taking down our security cameras and putting new ones up, or is it an
Correct.
expansion?
No,
It's taking them down and
yeah.
replacing.
And I think it's expansion too.
It's expansion, it's gonna be
It's
more
to cover-
areas and better cameras overall.
Okay.
Yeah, those have been very disappointing, and they actually, one of them actually fell off the building, which is concerning, because it was apparently put up there
Mhm.
with wood.
Did you, having just gone through hell with security cameras, have you worked with Imperial Surveillance before? And have you been able to see the quality of the?
I have not seen,
There's-
I
it's
have not
IT.
worked with Jason, worked with these people in the past, and I don't know if he's actually saw, what their cameras will do.
Okay.
I know they came in and gave a demo.
Yeah, they did. IT's been working with them, and the cameras too, are they movable from up there? Or I can't remember.
They have different coverage levels.
Yes,
of
so
some-
the way they'll put them on the building is that it'll cover all the zones,
Mhm.
but
Okay.
And then we've got new holders, they're made out of aluminum, so.
yeah, it was wood
Wood's
before
not
you
gonna be
said.
rotted off and dropped.
It looked like Imperial is, union and had an equivalent, score to the A and K mega service. And it was significantly less expensive. Okay. All those in favor say aye.
Aye.
Opposed, that carries. I'll make you comment now. Then next we'll have approval of bids and awardees for multiple CUPHD facility projects. We have a gate installation award, proposal for SK Exteriors, a fiscal year 26-004 TAS office area remodel, cubicles only, proposed award to Stocks Office Furniture, same organization for fiscal year 25, MCH conference room furniture, for fiscal year 20, I already said that, fiscal year 26, a resaling and restriping of all parking lot areas, proposed award to Illinois Central Concrete, fiscal year 26, HVAC replacement, RTU main conference room award to McCormick, same thing, RTU finance office, and RTU CHP administrative restroom area. All three proposed to go to McCormick service. And then RTU 514 MCH office area also award to McCormick service, all in fiscal year 26. And then fiscal year 26 HVAC replacement controllers, 2 zones award of Clo, controls and service Inc. I would entertain an omnibus motion for all of those projects.
So moved.
Second.
We have a motion and a second. Is there any discussion? I saw I went through and looked at the different point systems that had been indicated. I'll also share that the city of Urbana recently reached out looking to do a similar kind of ordinance to what we have. And I said that they should reach out to public health to get the documentation about the bidding and the points so that they can, and maybe possibly your list of who you've been reaching out to. So you may be getting a call.
And we also said that we're going to put that together and talk to, have it ready so we can talk about the places about it.
Yeah, I think what would be helpful, what might be nice, because there's a lot of interest in that right now, and because we've had the thing in place for a year, is to do like even a 2 or 3 page data-driven report on how it's going. You know, like what, you know, how much money has been spent, you know, how, and, you know, the support for local union, minority-owned, veteran, and disability-owned businesses. I keep getting a lot of questions about it because people are interested in replicating it, so it might be a nice model for other organizations and public entities.
To amplify that, I am so happy seeing that there's like a score and a system, and it's not just like, it seems like the better one.
Exactly. No, I really
We're lucky
think
we
it's
didn't
a very-
lose Jim during the process. It was a long process, but it finally got worked out,
Yeah.
Well, I
and
mean,
it works.
to show the process works so well is like the restriping. It actually ended up going to the higher bidder because of the point system. They just blew out the other people.
Yeah.
And the difference was still only about $2,000
Yeah.
on that striping, and on a lot of them, the points are still going to the lower, so it's.
Yeah. No, I mean, I see when it's been close, I think we've done a good job of like keeping the money local or reinvesting in, you know, helping basically businesses build their capacity to do more work, and the public sector is really important to that. And I've seen some outlandish proposals, I forget which one it was in here, where it was like, you know, tens of thousands of dollars of difference, and it's like, great, that's, you know, that is clear, you know, I'm glad that, I feel like we put an appropriate weight behind pricing, which is, you know, we're a fiduciary kind of stewards of the public's money, so I just want to say thank you. I think that this, especially today, is a really good model of many, many different projects where you've been able to vet the projects across a point system we set up. I do know that we talked in the original ordinance about setting goals, so I'd like to come back to that. If we look at a report of what we've done, we can look at goals, but I also feel right now, just based on the review that we've had so far, that, I'm proud of what we've been able to accomplish
It's
together.
gone way better than we thought. Even
Yeah.
some of the stuff that we didn't realize, that we were buying things from, like off the internet or whatever, we were able to find out that they are minority-owned businesses or women-owned businesses or whatever. So
Yeah.
that was kind of surprising.
Great.
'Cause
Well,
you-
so thank you. Okay, if there's no further discussion, all those in favor say aye.
Aye.
Opposed? That carries. And then we have discussion and vote on the payment of Presence Covenant Medical Center tax settlement. I know Ruth is abroad, and I know that we are voting on this at the town board tonight as well. But it is my understanding that essentially we've come to agreement on the payout, which is the amount owed minus interest. I did note that there isn't an IGA on this. Are we not party to the IGA?
There is.
Okay.
There is, that's what I think I have to sign. That's
Okay.
the thing that was the thing that was sent out, and I think I signed it, but I have to look. Because
Okay.
you guys signed for your units of government,
Mhm.
and then I'm pretty sure that I signed for here, is that right, Andy? I don't remember, I'll look. But
Okay.
yes, it was the one, or we've already, I think that was what was in the email, we'll get that. If it has to be signed, you will send it over
Okay.
to be a DocuSign.
Okay. Yeah, so right now, this is a discussion and vote on the payment to Presence Covenant Medical Center for the amount determined by our attorney in the context of conversations with the treasurer's office and the county.
And I still don't think we have an amount, do we? I mean, we have a
Yeah, we do.
general amount,
You
but
do.
we do? Do we
Yeah.
have the actual final amount?
Yeah, it's,
Because it's already been paid.
I think
Pay more than
actually,
that because we paid, pay judgment interest, so they'll get that back to us.
Okay, good.
yeah, it's, I think, I don't see it in the packets, I was gonna pull up the present settlement.
Again, I'm all too happy to walk over with a giant check for them.
If only they were even still here locally to
Yeah.
accept it, right?
Or state, yeah.
Yeah.
Okay. Yeah, so, any further discussion?
I have one thing I gotta ask. There was some new changes to the city permit policies that we weren't aware of, not even contractors. So it kind of put a delay on two projects. It was 25003 and 004, which is moving the opening over by the WIC area and then the installing of the new sliding glass door. The opening just got done. I got this done this last weekend, so I could not get that packet or the invoice into here. It looks like, now we have all the permits done, it looks like the door should be here within the next couple of weeks. So my question is, those will now, by the time I get invoices in, it's gonna be into the next fiscal year. So is it all right to, because I did not put money across, I thought it'd be already done. So how do we go about taking care of those?
Well,
It depends on the date of service.
Okay?
So if it was done in this fiscal year, it's gonna be recorded in this fiscal year.
Because the first part, the part one is done. And it should be, the part two should be done hopefully the last week of June.
And it'll all be in FY
Okay,
'25.
that's what I needed. Thank you.
I was trying to look it up for the presence document, the payment amount in attachment A of the settlement agreement is $126,042.37. And so that is the amount that we are agreeing to.
Harvey?
All those in favor say aye.
Unfortunately,
Yeah, that's fine, you can have a frowny face next to your eye.
Thank you.
All those opposed? The ayes have it. Pending grant contracts for the administrator to sign. I think there is one, just go to it is, between CUPHD and IPPH for comprehensive health protection grant fiscal year '26 in the amount of $478,627 for the contract period of June 1st, 2025 to June 30th, 2026. I believe we haven't had a contract in a while, but I think I need to entertain a motion to approve the administrator's service.
So moved.
Second.
A motion and a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. With no further business before us, we stand adjourned. Our next monthly meeting is July 9th, 2025 at 5 p.m. Oh, Securitas, they didn't work. They charged us for recurring expenses that we never